If your shoes feel tighter by evening. If you press your ankle and it leaves a dent. If your legs feel heavy, stiff, or almost waterlogged at night. Please don't ignore it. Tonight, I'm going to show you something that can dramatically change what your legs look and feel like by tomorrow morning, but I need you to understand something first. Swollen feet are not just a comfort issue, they are a signal, and depending on the cause, they can be harmless or they can be life-threatening. I'm Dr. Christina Serrati. Over the past 2 decades working with seniors and cardiovascular patients, I've seen ankle swelling dismissed as just aging, when in reality it was early heart failure. I've seen patients treated with unnecessary water pills, when the real problem was a medication side effect, and I've seen thousands of older adults completely reverse their daily swelling with one consistent nighttime strategy. Tonight, I'm going to give you a simple way to identify what type of swelling you have, the exact bedtime protocol that drains fluid overnight, the common medications that silently cause ankle swelling, and the emergency warning signs you must never ignore. Because here's the truth. If you use the wrong method for the wrong type of swelling, you can actually make it worse, but when you use the correct strategy, your body responds fast. Before we get into the solution, we need to understand something critical. There are 5 very different reasons feet swell after 60. And the fix depends entirely on which one you have. The first type is what I call gravity swelling. You sit, you stand, fluid slowly settles downward all day. By evening, your ankles look puffier. By morning, after lying flat, they look better. This is the most common and easiest to fix. The second type is vein weakness. Your leg veins contain tiny valves that push blood upward. When those valves weaken, fluid pools in the lower legs. This often comes with heaviness, visible veins, or darker skin near the ankles. The third type is lymphatic congestion. This feels different. The skin feels thicker, firmer. It doesn't bounce back quickly when pressed. This can happen after surgery, infection, or radiation. The fourth type is medication-induced swelling, and I cannot stress this enough. Some very common blood pressure drugs cause ankle swelling in up to 30% of patients. The fifth type is organ-related swelling, heart or kidney strain. This is the most serious. So before we talk about draining fluid overnight, you need to know which category you're in, and in the next section, I'm going to show you a simple 60-second test you can do at home that gives you powerful clues. But first, take a slow look at your ankles right now. Are they the same size? Is one larger? Do they improve by morning? These details matter more than you think. Let's move into the quick self-check that could potentially save your life. Before we talk about fixing anything, I want you to do something with me right now. Sit down, lift your pant leg slightly, and press your thumb firmly into the front of your shin, right over the bone, for a full 10 seconds. Don't just tap it. Press and hold. Now release. Look closely. Did it leave a dent? And more importantly, how long did that dent stay there? If the indentation lingers for more than 10 seconds before your skin slowly rises back up, that's called pitting edema. That means fluid is sitting in the tissue and not circulating properly. If your skin springs back immediately and feels thick or tight instead, that suggests a lymphatic issue. That difference matters. Now look at both legs. Are they equally swollen? Or is one noticeably larger than the other? If both legs are swollen about the same, and the swelling worsens as the day goes on but improves overnight, you're likely dealing with gravity-related swelling or medication-related fluid retention. If one leg is significantly more swollen, especially if it feels warm, tender, or painful, stop watching this video and seek medical care immediately. That could be a blood clot, and blood clots are not something you wait and see about. Now ask yourself this. Do you ever feel short of breath when lying flat? Do you wake up suddenly at night feeling like you need air? Have you gained 3 pounds in a day or 5 pounds in a week without changing your eating? Those are warning signs of heart-related swelling, and if your urine output has decreased, or you've noticed puffiness around your eyes in addition to your ankles, that could point toward kidney stress. I'm not telling you this to scare you. I'm telling you this because swelling is information. Your body is speaking, and when you interpret it correctly, you can respond appropriately. But here's the encouraging part for most seniors watching right now, especially if your swelling builds gradually through the day and improves overnight. This is mechanical fluid pooling, which means it is highly responsive to the correct nighttime protocol. In fact, when done properly, the body can move a surprising amount of trapped fluid. While you sleep, you may even wake up needing to urinate more. Often. That's not a problem. That's your kidneys finally getting access to the fluid that was stuck in your legs all day. In the next section, I'm going to show you the most misunderstood part of swelling management: elevation, because most people do it incorrectly, and when done wrong, it barely works. When done right, it changes everything. Let's talk about how to elevate your legs the correct way tonight. Asterisk if you've ever propped your feet on a pillow and thought, well, that didn't do much. You're not alone. Most seniors elevate their legs incorrectly and then assume elevation doesn't work, but the problem isn't elevation. It's positioning. Let me explain something very simple but very powerful. For fluid to drain out of your feet, gravity must work in your favor. That means your feet must be higher than your heart, not level, not slightly raised, higher. And here's where most people go wrong: they place a soft pillow under their calves. Their heels sink, their knees lock straight, their legs aren't fully supported, and within an hour, they slide down and lose the angle completely. That setup barely moves fluid. Here's what actually works: you need your legs elevated about 12 inches above heart level. That usually requires either a firm leg elevation wedge or multiple firm pillows stacked securely, or an adjustable bed with proper incline. The angle should be about 20 to 30 degrees. Too steep becomes uncomfortable, too flat won't create enough drainage. Your entire leg, from ankle to upper thigh, must be supported, not just your feet, and your knees should be slightly bent. Locking your knees straight compresses blood vessels behind them and can actually slow circulation. Now here's the part most people don't expect: you need to maintain that elevation for the entire night, not just 30 minutes, not just until you fall asleep, all night, because fluid doesn't instantly disappear. It slowly redistributes into circulation, then your kidneys filter it, then you eliminate it. That process takes hours. If you lower your legs halfway through the night because you get uncomfortable, you lose much of the benefit. Now, something important. If you wake up more frequently to urinate after doing this properly, don't panic. That is not your bladder acting up. That is fluid leaving your legs and finally being processed. I actually consider nighttime urination during this protocol a sign it's working. Now, some of you may be thinking, I can't sleep like that. I understand, your body may need 3 to 5 nights to adjust. Start slightly lower if needed, maybe 6 to 8 inches, then gradually increase. Comfort matters, but consistency matters more, because when elevation is done correctly and consistently, you often see visible reduction within 3 to 5 days, but elevation alone is not enough. During the day, gravity wins again, and if you don't prevent fluid from pooling in the first place, you're fighting an uphill battle. That's where the second critical piece comes in: compression, and I'm going to tell you exactly which kind works, and which kind is a waste of money. Now let's talk about something that makes a dramatic difference when it's done correctly: compression. But I need to clarify something immediately. You do not sleep in compression stockings. I see this mistake all the time. Compression is for the daytime, elevation is for nighttime. They work together, but they serve different purposes. Here's why: during the day, your upright gravity is constantly pulling fluid downward into your ankles and feet. If your veins are slightly weak, which happens naturally with age, that fluid begins to pool. Compression stockings act like external support for your veins. They gently squeeze the leg in a very specific way that encourages fluid to move upward instead of settling. But not all compression stockings are the same, and this is where most people waste money. You need what's called graduated compression. That means the pressure is strongest at the ankle and gradually decreases as it moves up the leg. That gradient creates upward movement. If the pressure is equal everywhere, it doesn't work properly. Now let's talk numbers. Compression levels are measured in millimeters of mercury, the same unit used in blood pressure readings. For mild to moderate swelling, you want 15 to 20 mmHg. For more noticeable swelling or diagnosed vein weakness, 20 to 30 millimeters of mercury is more effective. Anything lower than 15 millimeters of mercury is essentially just tight socks. They may feel supportive, but they don't significantly move fluid. Here's another mistake: putting them on after you've already been walking around. By then, fluid has already accumulated. You must put them on first thing in the morning before your feet hit the floor. Keep them by your bedside. Wake up, sit up, slide them on while your legs are still relatively fluid free from lying down all night, then stand that Timing alone can dramatically reduce how swollen your ankles look by evening. Wear them all day, remove them at night before elevation, wash them regularly, and replace them every 3 to 6 months, because stretched out compression doesn't compress anymore now. I know some of you are thinking they're uncomfortable. They're hard to put on. Yes. At first they can be. There are tools designed to help slide them on more easily, and within a week most patients adapt. But here's what I want you to understand: compression is prevention, elevation is drainage. You need both, and when you combine them consistently, something powerful happens. You stop chasing swelling, and you start controlling it. But we're not done. There's a third element that most doctors never teach patients. It takes 5 minutes, you can do it yourself, and it manually pushes fluid out of the tissue before you even lie down. In part 5, I'm going to show you the exact technique. Now I'm going to show you something that almost no one teaches seniors. It takes 5 minutes, you can do it yourself, and when combined with elevation, it accelerates overnight drainage dramatically. This is gentle lymphatic activation, not deep massage, not aggressive squeezing. In fact, pressing too hard actually makes it less effective. Your lymphatic system sits just under the skin. It doesn't have a pump like your heart. It relies on light pressure and movement to circulate fluid, and when we stimulate it properly before bed, we essentially prime the pump. Here's how you do it. Sit comfortably on your bed before elevating your legs. Start at your upper thigh, place both hands gently around your thigh and make slow, light sweeping strokes upward toward your groin. That's where major lymph nodes are located. Do 10 slow strokes, not fast, not forceful, light enough that you're just moving the skin. Next, move down to just above your knee again. Sweep upward toward your thigh. 10 strokes, then move to your lower leg, from ankle to knee. 10 slow strokes upward. Finally, focus on your foot, using your thumbs. Gently stroke from your toes toward your ankle. 10 times on the top of the foot. 10 times on the sole. That's 1 round. Repeat the entire sequence 3 times. It should take about 5 minutes total. You are not trying to force fluid out, you are signaling the lymph vessels to contract and move fluid naturally, and when you then elevate your legs immediately afterward, you've created a perfect drainage pathway. Think of it like clearing a pipe before turning on water flow. Now here's what many people notice when they combine daytime compression and nighttime elevation, and this 5-minute lymphatic sequence. They see visible reduction within days, not months, days. But there's something else we need to address, because some of you may be unknowingly making swelling worse every single day, and it has nothing to do with elevation or massage. It's sodium and hydration timing. In the next section, I'm going to explain why drinking less water actually makes swelling worse, and how to hydrate strategically to reduce fluid retention safely. Now we need to clear up one of the most dangerous myths I hear from seniors. I stopped drinking as much water because my feet were swelling. I understand the logic. If you have too much fluid, drink less fluid. It sounds reasonable, but physiologically, it backfires. When your body senses dehydration, it shifts into survival mode. Your kidneys conserve water, hormones like aldosterone increase, sodium retention goes up, and instead of releasing fluid, your body holds on to it tighter. That means swelling often worsens, not improves. So here's the strategy that actually works: you hydrate strategically, not excessively, not restrictively, strategically. You drink the majority of your fluids earlier in the day, from wake up until about 5 p.m. Aim for steady hydration, small glasses spread throughout the day. Then, after dinner, taper off. 1 small glass with your evening meal if needed. After that, only small sips for medications. Stop all fluids about 2 hours before bed. This allows your kidneys to function properly during the day, without adding excess fluid right before you lie down. Now let's talk about sodium, because sodium is the true driver of fluid retention. Most seniors consume between 3,000 and 5,000 milligrams per day. That's far too high. If you're struggling with swelling, your target should be closer to 1,500 milligrams daily, and ideally closer to 1,000 milligrams if swelling is significant. That means no canned soups. No deli meats. No frozen dinners. No restaurant meals. No salty snacks. Even bread and cheese can quietly contain high sodium levels. Instead, cook fresh when possible. Use herbs, lemon, garlic, and spices for flavor instead of salt. When sodium drops, Your body stops clinging to excess water, and many people see noticeable improvement within 2 weeks. Now, here's something else few doctors emphasize: some medications directly cause fluid retention, and if that's your trigger, no amount of elevation or massage will completely solve it. In the next section, I'm going to tell you which medications are the most common hidden causes of ankle swelling after 60. This may be the missing piece for many of you. Now we're going to talk about something that surprises many of my patients sometimes. Your swollen ankles are not a circulation problem. They're a prescription problem, and unless someone connects the dots, you can spend years trying to manage swelling that is actually a medication side effect. Let me walk you through the most common culprits I see. The number one offender? Certain blood pressure medications called calcium channel blockers. If you are taking medications like amlodipine, nifedipine, or similar drugs, listen carefully. Up to 30% of people on these medications develop ankle swelling, and here's the frustrating part: it's dose dependent. The higher the dose, the more likely the swelling. Many doctors respond by adding a water pill, but that's treating a side effect with another medication. Often, simply switching to a different blood pressure class, such as an ACE inhibitor or ARB, resolves the swelling without adding more drugs. Do not stop your medication on your own, but absolutely discuss this with your physician. Next category: NSAIDs. That includes ibuprofen, naproxen, and many prescription anti-inflammatories. These medications affect kidney function, and when kidney function shifts even slightly, fluid retention increases. If you take NSAIDs regularly for arthritis and you have ankle swelling, reducing or stopping them, under guidance, may significantly improve fluid retention within 1 to 2 weeks. Steroids are another major trigger. Prednisone and related medications cause sodium retention and water retention. If you are on chronic steroids, discuss with your doctor whether your dose can be minimized safely. Some diabetes medications, particularly older ones like pioglitazone, are also known to cause fluid retention, and in susceptible individuals, they can worsen heart failure. Hormone replacement therapy and even certain antidepressants can contribute in some people. The key is this: if your swelling started within weeks of starting a new medication, or worsened after a dosage increase, there may be a connection, and if medication is the driver, no amount of elevation will fully fix it. You must address the root cause. Now, before we move forward, I need to pause on something serious. There are certain warning signs that mean this is not something to manage at home. In the next section, I'm going to outline the emergency symptoms you must never ignore, and then I'll give you the complete nightly routine laid out step by step so you can start tonight safely. Before I give you your exact step-by-step bedtime plan, we need to draw a very clear line. Most chronic swelling is manageable, but some swelling is dangerous, and you must know the difference. If one leg suddenly becomes much more swollen than the other, especially if it feels warm, painful, red, or tender, do not wait. That could be a blood clot. Go to the emergency room immediately. If both legs swell rapidly over a few days and you also feel short of breath, or you cannot lie flat without feeling like you're suffocating, or you wake up gasping for air, that may be heart failure. Call your doctor or emergency services. If swelling is accompanied by chest pain, confusion, abdominal swelling, yellowing of the eyes, or severe fatigue, that is not routine edema. That requires urgent evaluation. Now. If your swelling is gradual to bilateral, worse by evening, improves somewhat overnight, and not accompanied by severe symptoms, then you are exactly who this protocol is designed for. Here is your complete nightly routine, starting tonight. 6:00 p.m. Eat a low-sodium dinner. Avoid processed foods completely. After dinner, only small sips of water if needed. Stop all fluids 2 hours before bed. 9:00 p.m. Perform your 5-minute lymphatic sequence: thigh upward strokes, knee upward strokes, calf upward strokes, foot toward ankle strokes. Repeat 3 times. 9:15 p.m. Take 400 mg magnesium glycinate if approved by your physician. If you have diagnosed vein insufficiency and your doctor approves, consider standardized horse chestnut extract as directed. 9:30 p.m. Get into bed, position your legs 12 inches above heart level at a 20 to 30 degrees incline, support your entire leg, slight bend in the knees. Maintain this position throughout the night. Expect to urinate more. That is fluid finally leaving your legs. Morning. Before your feet touch the floor, put on graduated compression stockings. Wear Them all day, remove at night, repeat daily now. Here's something powerful: when seniors follow this consistently for 2 weeks, most see measurable improvement. By 4 to 6 weeks, swelling often reduces dramatically, but consistency is everything, not occasionally, not when you remember every night. Your legs carried you through your entire life, they deserve structured support now.